This video will cover hereditary stomatocytosis, which is a cytoskeletal disorder of red blood cells. Kings are normally dominant figures, right? The king here represents autosomal dominant inheritance. It looks like the king might have just gotten some lip work done. The large mouth and lips are to remind us of stomatocytes, red blood cells that are mouth-shaped. There are two main subtypes we will cover, and those are represented by the king's servants on his left and right. The servant who looks rather dehydrated represents the xerocytotic subtype. Xeros is a Greek word that translates to arid or dry. Do you see the target on the servant's shirt? That represents target cells, which are commonly seen in this subtype. The last point to remember about this subtype is that acanthocytes are commonly seen. These are red blood cells with projections and are represented in this image by that plant with thorns next to the servant. Moving on to the other servant and subtype, I'm not sure what that red liquid in the bottle is. It might be for his own recreation or maybe a gift to the king. Regardless, it helps us remember that this subtype is known as the hydrocytotic or overhydrated subtype, and that hemolysis is commonly seen. While I did include a prompt to remember that macrocytosis and low MCHC are also common features, I think those can be reasoned through fairly easily. The monkey, which we'll call a rhesus monkey, helps us remember that this disease is commonly seen in association with the Rh null phenotype. Lastly, let's remember our fellow surgeon colleagues who use tools every day in their practice. The wrench in this scenario with that sticky goop on it is a reminder that splenectomy is often avoided in these patients because they tend to have issues with thrombosis post-surgery.